Welcome to Wellness Wednesdays. Thank you so much for joining us today. We're so glad to be back after our summer hiatus. And so it's nice to have new information and fun things to share with you. So thank you so much for joining us today. I'm Anne Marie Medina. I'm the Director of Corporate and Community Relations for the University of Arizona Health Sciences. I'm located here at our beautiful Tucson campus. We also have Caroline Berger, who is our director up at our Phoenix Biomedical Campus, and Allison Otu, who serves as our executive director. And we'd love to hear from you anytime. Please don't ever hesitate to reach out. I would like to respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through educational offerings, partnerships, and community service. So right now, I'd like to show you a quick video of our University of Arizona Health Sciences. Let's see if I can get this one to play.
Welcome to the University of Arizona Health Sciences. As the statewide leader in biomedical research and health professions training, Health Sciences includes College of Medicine Tucson, College of Medicine Phoenix, College of Nursing, College of Pharmacy, and the Melanenid Zuckerman College of Public Health. Together, they provide cutting-edge health education, breakthrough research, and a diverse offering of community outreach services. At the heart of health sciences, our employees, nearly 5,000 along with 4,000 students, makes us one of the top employers in the state. Our growing research and education programs are offered on 2 campuses, one at the main campus in Tucson and the other in the heart of downtown Phoenix on the biomedical campus. The University of Arizona Health Sciences is a major contributor to UArizona's well-earned reputation as one of the country's top research institutions. And each year, we receive more than $200 million in research grants and contracts, providing vital funding to help address some of our most critical healthcare challenges. We are grateful for this support, which is fueling discoveries and treatments in areas including cardiovascular disease, cancer, Alzheimer's disease, and now COVID-19. The University of Arizona Health Sciences is also in a unique position to effect change in a rapidly shifting healthcare landscape. As part of our strategic plan, we have developed a set of initiatives to reshape the future of healthcare. We are focusing our efforts on 5 important areas: next-generation education, precision healthcare for all, making wellness ageless, creating defenses against disease, and new frontiers for better health. Through these strategic initiatives, we have unprecedented opportunities to excel in education and research in more and better ways than ever before, and we invite you to join us on this journey. Please know that our dedicated corporate and community relations team is here to be your connector with health sciences. Thank you for your dedication and for all that you do to make our communities healthy.
Wonderful. Well, we would love to have you come and visit us also. So if you have any other additional questions or would love to see either the Health Sciences Innovation Building or the Biomedical Campus, please contact us. We'd love to give you a tour. And we'd also love for you to follow us on all of our social media platforms, and make sure you follow me at A Medina Wildcat for the latest news and updates. Today, we will have a wonderful presentation, and I'm sure you're going to have a lot of questions or comments, so please leave those in the chat. And at the end of the presentation, I will be asking those questions to our presenter. Again, you will always get that session evaluation at the end. We appreciate that feedback. We'll also provide you with, links and resources that will be provided. Link to the video for today's session, and of course, links to all of our past sessions if you want to catch up. So today, I would love to introduce you to our speaker. Our speaker today is Terri Warholak, and she is a professor and assistant dean of academic affairs and assessment at the University of Arizona College of Pharmacy. In 2015, Dr. Warholak and colleagues won the Academy for Healthcare Improvement Duncan Newhouser Award for Curricular Innovation for the Educating Pharmacists in Quality, or EPIC program. She serves on national committees, including Food and Drug Administration Drug Safety and Risk Management Advisory Committee and National Quality Forum Scientific Methods Panel. Her research interests include medication error reduction and quality measure development. She has edited a book, published over 135 papers, and is presented at the state, national, and international levels. And she is here today to talk to you about a very important topic, especially now, women's health, building resiliency, and tackling adversity. So Terri, welcome so much. I'm going to let you take away the show.
Hi. Thank you so much for having me. I will share my screen. All right, let me go to presenter mode first. Just when you think you're ready, you're not ready.
It's all about resilience.
I know. I'm going to tell you a little bit in a second about how I fail all the time. Maybe this is one of those times. Okay, I think I figured it out. There we go. Okay. All right. So thank you for being here for our resilience talk, how to build resilience and tackle adversity. So let's go ahead and move on. So what is resilience? So I found this from the Oxford Dictionary, and resilience is the capacity to recover quickly from difficulties. It's a toughness. I also like this secondary definition, although it's not about people per se, but it's the ability of a substance or object to spring back into a shape, or elasticity. And so really this is what we're talking about today, how to recover from difficulties and how to have that elasticity in your life. So as we get started, I wanted to tell you a little bit about me. This talk is going to be kind of part TED Talk and kind of part research, so or presenting the research. So let me tell you a little bit about who I am. So I am a pharmacist by training. I went to Purdue University. After pharmacy school, I accepted a commission in the United States Public Health Service, and I was stationed at the Indian Health Service at the Phoenix Indian Medical Center at 16th and Indian School in Phoenix. I worked both inpatient and outpatient pharmacy there for about 6 years, and then I decided to go back to school to get my master's and my PhD. And I'll tell you a little bit more about what led to that decision later. I currently serve on several different panels, as was discussed by Anne Marie. And for example, I sit on the United States Pharmacopoeia Convention on healthcare quality. I serve as a methods evaluator for the National Quality Forum for quality measures. I sit on the FDA's Drug Safety and Risk Management panel. And I've also helped to create a educational program that over 20 schools of pharmacy were using, in addition to editing a book. So that may make it seem like I've been pretty successful. But what I wanted to share with you is it's not clear from all that I struggle every day. And I want to tell you a little bit more about how I struggle and hopefully how my story might be able to help you. So the idea for what I'm going to tell you next came from a woman named Melanie Stefan. And Melanie Stefan is a researcher, a very successful one in the United Kingdom. And she created something called her CV of failures. When you look at the list of accomplishments that I presented on a previous slide, or when you look at my curriculum vitae or CV, you might look at it and think, oh, it's 58 pages long. Clearly, her life has been so easy. She's never struggled, and things just come easy to her. And if that's what you're assuming from looking at that, you would be very wrong. And so I want to tell you a little bit about that. But the idea for that came from Melanie. What she did was she took her CV and she made kind of a shadow CV. And that CV lists everything she had ever failed at in her life. And so it included things like the programs she didn't get into, the schools she didn't get into, the times where she's a basic scientist. They told her, or her supervisors told her that science was not for her and that she should give up and she should find something else to do. And the grants she didn't get, and the postdocs she didn't get, and the publications that didn't go anywhere. So many different things. And I thought, what a great idea, because this really helps, I think, students and others to see that even when you're looking at somebody's list of accomplishments, it does not mean that they haven't struggled. It means that these are the things that they've succeeded at. And there's probably a lot of things behind the scenes that you haven't seen that maybe weren't as successful. So let me tell you about that. So I want to tell you a little bit about how I fail at, in my opinion, I fail at something every day. So back when I was in pharmacy school, the advisor for the program actually sat me down and told me I did not have what it takes to be a pharmacist. And after being very upset, I thought, you know what? Challenge accepted. Like, you think I can't do it? I'm so going to prove you wrong. And I did it. Other things that go wrong all the time are like things like brutal feedback from students. I don't know if you guys know about this or not, but oftentimes faculty, when they get feedback on a course or a lecture or what have you, sometimes the feedback is not always about the course or the lecture, but sometimes in the feedback that we get, it is sometimes inappropriate and sometimes even sexualized. Sometimes we get feedback as female faculty indicating that, about our physical attributes or things like that. Definitely things that I'm just who I am and I can't change any of that. And it has nothing to do with the educational experience in and of itself. However, just as a side note, I am on a national task force about women in academia, and we have seen this all across the country. So, there's like little attacks there. Every academician gets articles rejected in the peer review process, and sometimes peer reviewers are not very nice. So you'll see that probably on, like, I'll get one of those on an every other day basis. There are, of course, hypotheses that were wrong. There's miscommunication. The list of grants that I applied for and did not get is voluminous. So I'm going to share with you a specific example about one of my failures. So as I mentioned before, when I first graduated from pharmacy school, I accepted a commission in the public health service, and I was stationed in the Indian Health Service. Well, the Indian Health Service pharmacy practice is very advanced, and sometime in the late 1960s, they decided that filling prescriptions from little pieces of paper that had no additional information about the patient on them was inappropriate. And so starting in the late 60s, they made it so that Indian Health Service wide, whenever a patient had a new medication or a refill medication, the pharmacist got the entire patient's chart. And at the time I was there, it was actually a physical chart. And that way the pharmacist could look at the patient's complaint, the history and physical data, the diagnosis, the other medications, the lab values, etc. And we could use that information to really evaluate the appropriateness of the particular medication, dose, duration, etc. that the patient had been prescribed to ensure that it was the right medication for the patient at that point in time and wasn't going to cause any adverse events. Well, when I went back to grad school, I started working in a community pharmacy. And as I'm sure you're probably all aware, in a community pharmacy in the United States, you don't have that level of information about your patients. So now we're back to, this was the mid-90s, so it was not electronic prescriptions, but rather a little piece of paper with a drug name written on it and a directions for use and a number of the strength and the number of units for the medication. And this I found really terrifying. I likened it to practicing with my eyes shut. because all of a sudden I knew nothing about my patients. I couldn't evaluate anything. I couldn't look at if it was the right drug for the particular diagnosis. I couldn't evaluate based on lab values. I couldn't use what I learned to help patients. So it really limited me. So at the time, there was a bill in Congress, and it was HIPAA, which I'm sure you all know. But then one of the provisions of HIPAA was that they would give the information to different people within the healthcare system, quote, the minimum necessary information that they needed. And what I was afraid of is I was afraid that people in Congress, for example, who perhaps didn't know any better, might make the decision that pharmacists didn't need any information because they should just, fill the medication like they were a machine. So what I did was I created this study. And this study was a simulation where I evaluated if pharmacists had more information about the patient, would they be better able to make higher quality decisions about the appropriateness of that medication? Would they be able to pick up on medication errors and problems in therapy? Short answer is yes. The more information they had, the better. So I was pretty excited about this. And I went ahead and I crafted my very first scientific article with my mentor. And we submitted it to a journal. So this is back in the day where I had to write a letter, and I put the manuscript in a FedEx envelope, and I sent it off, and I was so excited. Well, a couple weeks later, I got back a paper letter, and the paper letter said, and I'm going to paraphrase, it said, "This is stupid. I don't know why you did this. Everybody knows that having more information, leads to better decisions for pharmacists, and you wasted your time." So I'm crying, and I went into my mentor's office, and I'm holding the letter, and I'm getting ready to tear it up. And he said, no, you're going to want that. And I was like, I can't imagine why, but fine. If you say I'm going to want it someday, I'll keep it. And so after I calmed down, we revised the material in the article. We resubmitted it to another journal. This actually led to a national award for our study and a lot of press as well. And 10 years later, that organization called me and they said, hey, you've been really successful in getting published. Why don't you come talk to young scientists about how to get published? And I went to my file cabinet and I found my letter and I said, why, yes, I would love to give such a talk. And so I got to read that letter on a national level at a national meeting. And I didn't do it to be vindictive. I think the point is that when things like this happen, it doesn't define you. And it's one person's opinion. One person said that it was a waste of time. Another group gave us an award for it. And it was cited quite a bit. So I think the important part here is to recognize when you fail, you're not alone. Look at that CV of failures from Melanie Stefan. Think about some of the experiences I've had and recognize that part of resilience is just saying, okay, one person didn't like it. That might be upsetting. It could even be crushing for a little while, and that's okay. You can feel that. But at some point, I just have to say, all right, moving on. And so one of the points I want to make here is you're not alone. We have all failed so many times. And I will tell you about more of my failures in just a minute. But getting a mentor and somebody to talk to is so important. Having that mentor helped me to realize that's just one person's opinion. We're going to submit it elsewhere. It changed everything because of the award, because of how differently it turned out the second time. And we changed very little of it. So make sure you've got mentors. Also, make sure that you have other people to talk to, whether it just be your friend, your roommate, your significant other. Make sure you're just expressing these things and talking to people, because we can be, when we fail, and I know for myself, we can be very ashamed that these things have happened and feel like it is a weakness or a reflection of who we are. And talking to someone else, getting loud there for a second. But talking to someone else really helps you to see that you are not alone. And this happens all the time. And it's just one of the things that we have to go through to be successful overall. So I'll tell you about another one of my failures. We could be here all day if I'm telling you about my failures, but this one, there's a point to this one too. There was the medication error that changed my life, right? So I was a pharmacist in the Indian Health Service, and one morning, about 5 years into working, I came into the pharmacy, and my supervisor said, I need to speak to you in my office. And so, of course, the first thing that happened is my stomach sank, and I got like kind of jittery and nervous, and because I had no idea what was going to happen, but I could pretty much tell that it wasn't good news. Well, what had happened was that I was one of several people that were involved. We kind of did a piecework process for filling prescriptions and counseling patients. And I was one of the ones involved in a medication error. The medication error was, the bottom line was that a patient who was an AIDS patient, we gave that person an immunosuppressant instead of an immunomodulator. And I was crushed. Like, the whole reason I wanted to be a pharmacist was to help people. And for me, helping people was success. And up until that point, I thought that's what I'd been doing with my life. But on that day, I thought, well, that's it. I failed. And so I went home that night, and it was like the worst night. So I can tell you that, like, I've lost my parents, and other than losing my parents, this was the second worst thing I had ever felt. It was horrible. Getting a little verklempt just talking about it. So I came in the next day, and I had a resignation letter, and I gave it to my supervisor, and he looked at me and he tore it up, and he said, no, we cannot let this happen. If everybody who cared quit when they were involved in an error, we would have nobody left in healthcare who cared. Because everybody, pharmacists, physicians, nurses, everybody in healthcare is going to be involved in medication errors in their professional lifetime. And so what he challenged me to do instead was to take a look at it and see how it happened, why it had happened. Well, in doing so, what I discovered was that a medication abbreviation was used, 3 letters, and that those 3 letters were used for both of those same drugs. One was an immunomodulator, one was an immunosuppressant. Exact same abbreviation. And this is why the Institute for Safe Medication Practices has that list of abbreviations you should never use. And I'll also recommend that when prescribing not to use abbreviations. Anyway, so it turned out that thousands of pharmacists all across the country had made the exact same error as me. So back in the day, before To Err Is Human came out, what they used to do when anybody in healthcare was involved in an error, and people were involved in errors all the time, what they would do is, basically what I call shame and blame. And so what they would do is say, like, okay, well, you obviously have a knowledge gap in this area, you need to improve. However, I also discovered that because this was happening thousands of times across the country, that educating me more about these 2 medication abbreviations wouldn't change that somebody else might have the same problem 10 states away tomorrow. So I identified systems theory. And systems theory is something that was used in the aviation industry and helped them to improve and decrease mistakes. And then after To Err Is Human came out from the Institute of Medicine in 1999, they started to use it in healthcare. But once I identified systems theory, a light bulb went off, and it changed what I did. And so my new mission was to improve the quality and safety of pharmacy practice. And so because I now had a new mission, I needed to do things on a larger scale. That's why I went back to school. I got my master's and my PhD. I specifically focused on systems theory and quality improvement and medication error reduction. I created courses for pharmacy students that are used all across the country now. And it helps to teach the next generation of pharmacists how to look at a system and figure out where your weaknesses are and how to intervene on problems before they become an issue. So the point here is, from this failure, from this horribly devastating event, the patient ended up being fine, by the way, that sometimes a traumatic event like this can lead to a positive change. So my second recommendation about resilience, after realizing you're not alone and that we all fail and talk to someone, is to also recognize that sometimes you can bring something good out of a really traumatic event. So look for those opportunities as they happen to you. How can you learn from it? How can you make the world a better place? Building on and hopefully fixing what happened to you. So think about that you always have a choice, right? You can choose to be a victim, or you can choose to say, this was horrible. I don't want it to happen to anybody else. I can fix this. I can improve it. I can learn. And then set a goal and then delineate steps to achieve it. So that's another way to develop resilience. So another thing to think about is, how do you create and maintain a positive mindset? One of the things I like to look at is the work of Carol Dweck, and she wrote this book called Mindset, The New Psychology of Success, and it's really a great book. And one of the things she talks about in here is the power of yet. So, for example, we can use this to edit our self-talk. So instead of saying, I'm not really good at, let's say at the beginning, writing scientific articles, she encourages you to say instead, I'm not really good at writing scientific articles yet. So it's the power of yet, the power of, we can do this. I can grow and learn and be better my entire life. And just because I am who I am today doesn't mean I can't be better tomorrow. Doesn't mean we all can't be better tomorrow. So always think about the power of yet. What haven't you succeeded at yet that you want to learn to succeed at? So change the way you think about it and talk to yourself. I'm not good at that yet. I'm not an expert at that yet. Also think about the Edison quote. You know, it took Thomas Edison many tries before he was able to create a monofilament light bulb that worked. And, you know, there's quotes that are attributed to him famously saying, you know, I haven't failed 115 times to make a light bulb. I've just found 115 ways that didn't work. And then eventually one does work. And this is so important in the sciences, because the sciences fail all the time, right? We have to try and try and try again, because the goal of science is to add that little piece of information onto the body of knowledge that's going to help the next person. And it might take you a while to get there, but it does feel really good when you do contribute. So now on to the researchy part. So these are some of the articles I looked at, and several of them, as you can see, are systematic reviews, and they're about resilience. And it's really fascinating because a lot of work that's done with resilience is done in children, especially after a traumatic event. So you'll see some articles that focus on that. You'll also see a couple here that are in healthcare professionals, one specifically in psychiatrists. And then there's one here in the bottom corner that I thought was really fascinating. And that looked at resilience overall. And we always think of resilience as a personal thing, right? But as that definition indicated at the very beginning, resilience can be looked at as a physical manifestation as well. And, oh, nope, that's not the right one. Oh, it's this one. This one, the Integrated Framework for Resilience Research, a systematic review based on a network analysis. That particular article is really interesting because it includes in it all kinds of things, everything from the resilience of ecosystems to people. So people are looking at resilience in a lot of different directions. So I just thought that was interesting and wanted to share that with you. So what I'm going to show you here is I'm going to take you through a couple of the recommendations or the findings from some of these articles. So the results go horizontally with the article. So this first one was about children, but I think it's largely applicable to adults. And what they found is there's support for resilience factors on the individual level. And one way you can have better resilience is to have higher self-esteem. I know that's a lifelong struggle for me, and I think that's important. And so one of the ways you can address that, of course, is keeping a list of all the things that you've done and you've succeeded at. I actually keep a file called kind words, which sounds silly, I know, but like there's going to be dark days, right? And on a dark day, I can open my kind words file and like see thank yous and other things from people that I've helped to influence over my lifetime. And that really helps. Another thing, and I got to tell you, I struggle with this as well, is low rumination leads to higher resilience. And rumination is like rerunning all the things that didn't go right over in your head over and over and over again. So the more that you can stop doing that, the better off you'll be with resilience. And it's okay, of course, to feel your feelings and to be sad, but at some point you have to start to come up with mechanisms to help you to like stop doing that. So I actually came up with for my internal speak, when I start doing this, I actually like physically stop whatever I'm doing. And then in my head, I say, stop, no, done, enough. And then moving on, and then talk about, fine, how are we going to move forward? What are our new goals? How are we going to change this, right? So at some point, you got to stop yourself and don't let yourself keep running over your mistakes over and over again, because I can tell you on a lifetime level, and I've been a pharmacist now for 30 years, it's going to add up. So don't do that to yourself. Also, on a family level, high family cohesion and parental involvement leads to resilience. And so this might help you with, your patients or with your own kids. And then at the community level, social support is so important. Making sure that you have those people to go to, those mentors, those colleagues, those people that you can talk to so that you can see that you're not alone and that we're all going through struggles all the time. So in this next article, this one, here's some other factors that they found were associated with resilience. And I'm just going to hit on the ones that were different. Hope. Hope is so important. Recognizing that maybe things are not optimal today, but at some point they may be better. That there is a chance for optimism, that there's a reason for hope, that you can look into the future and think, okay, things can be better. And then you can start to think about how you can help to make them better. Also, this I thought was interesting, friendship quality and quantity. Having not only really, really close, good friends, but having a lot of people that you can just go hang out with and really feel connected to a community really helps with resilience. Also, internal locus of control, really important. It's important to recognize that we have control about what goes on in our heads. We have control about how we view a situation and what we do in response to a failure. And then empathy, making sure that we see that, other people are failing too, and that we're just one of the group. Oh, looks like I skipped a slide. There it goes. I'm going back. All right, so in psychiatrists specifically, these were factors that facilitate resilience, reducing burnout. And another thing here is that women are more at risk for burnout for a number of reasons, not the least of which is a lot of times they take on additional roles in the home and do additional things. So as a woman of a certain age, I can tell you, choose partners wisely. Make sure that whomever you choose to spend your life with is going to be a force multiplier, not a force divider, so that you can have a long career that you're working so hard for right now. Psychological support, going to therapy, talking to your friends, taking holidays. This is really important, making sure that you're taking that time off. People come back so much more refreshed, so much more resilient after a vacation That is essential. Take that time that you have earned, that you deserve. Have some hobbies, have some fun things that you don't have to think about work during, things especially that take your mind off of it, that you're doing it and you don't even remember that you have work or school or a job or whatever it is, those kinds of things. And then more help from your partner. Now, this one is in health professionals specifically. And they broke it into 4 different categories, the first of which is individual factors. And one of them that we haven't talked about is having a higher purpose. And as people who are in the healthcare field, I think you already feel that, right? You are doing this oftentimes not for the money, not for the glory. You're doing it to help people, to make the world a better place. And that really helps to build resilience. Also, too, this is really interesting, environmental and organizational factors. When you choose a workplace after you're done with school, make sure you choose one that has a good workplace culture. And one of the ways you can find that out when you do your interviews, as you talk to each person, you can say, what's your favorite part of working here? What's your least favorite part of working here? And the more people you ask, the better the picture starts to come together about the way the workplace works, about the environment, and if you're going to fit there, and if it's going to be healthy for you. Then also making sure that you have and use self-reflection. However, not to the extreme. Don't ruminate. Once you feel your feelings, at some point say, that's it, stop. We're moving on. We're coming up with a plan for getting better and moving forward. And then even going to resilience workshops. If you can find those are great and they've helped a lot of people. So I put this into, and this actually came from a company, but the thing that I wanted to mention here that wasn't mentioned directly in the research that I saw was this health section at the bottom. Getting good sleep, making sure you're eating well, making sure you're getting regular exercise. You got to take care of you. Part of being resilient is, making yourself last for a career. And some of you might be in your profession for 40 years. That's a long time. So you got to take care of the vessel that's going to get you there. And if you don't do that and you burn out, I've actually seen people who had a PhD who just turned it all in and went to sell antiques because they just couldn't take it anymore. So you're doing all this work now, make sure it's going to last for the rest of your life. And so it's really important to take care of yourself. So here's some additional resources that have really helped me. One of them, the first one is a book from Angela Duckworth, and it's called Grit. And it is the power of passion and perseverance. Great book about how to persevere, how to be resilient. The next one in the middle is We Can Do Hard Things with Glennon Doyle. That's a podcast. And that's, oh man, some really great pithy stories, especially for women here on how to be resilient, how to look at things a little differently. Really important, really good work she's doing. And then the last one is by Brene Brown. Now, she obviously has podcasts, etc., but she has this book called The Gifts of Imperfection. And it has these different pillars, and you can actually go online and take an assessment to see where you are with the different pillars. And then you can read the chapter about that pillar, and it'll give you tips for doing better and accepting yourself and being more resilient. So before I open it up to discussion and comments, I wanted to just say that don't be ashamed of your story. It will inspire others. In the end, you will be the inspiration for other people. So make sure you're paying it forward. And part of paying it forward is sharing your story with others. Because just like that CV of failures, just like the things that I shared with you, if people who are successful never share their struggles, then the subsequent generations will never know that. And they will all think that they are having a hard time because it's their fault. When in fact, that's just the human condition. And that's just how we grow and change over time. So inspire others by sharing your story. So here's some discussion questions. How do you build mental resilience? How do you create and maintain a positive mindset? What do you do about your self-limiting beliefs? How do you take control of your life? What techniques have worked for you? And what questions do you have? Do you want me to stop sharing, Anne-Marie?
You know what? I think let's leave that up just so that we can maybe keep that on people's minds. I don't know if you want to stick that in the chat, Terry, but I think there's some wonderful questions. We've gotten some great comments, and someone mentioned that this was a brave and relevant talk, and they were finding it very helpful. One woman was wanting to know if there was any opportunity or any workshops that you knew of on suicide prevention. We know that recently suicide has increased due to, I think, the stress that people have been under has been exacerbated, but also I think it's also raised awareness of people that are struggling. Do you know of any suicide prevention programs that are out there, or do you do a talk on that? Because if not, I do, and I can certainly share that in the resources, and I'll follow up email. So Carolyn, I will send you some information.
I wish I knew some. I do not. I'm sorry.
Okay. One of the other things, you were talking about sharing your story. And I was talking with someone the other day, a person that I'm actually possibly going to be presenting at a conference with. And he was talking about a situation where there was a healthcare worker who had been working nonstop during the pandemic and had been working long hours, gone home, got a little rest, came back, and walked in, and her supervisor said, how you doing? Of course, she said, I'm okay, and he said, stopped her, put his hands on her arms and looked at her and said, no, how are you really doing? And she just, completely broke down. I think it's really important for us to have the courage to ask that question of people and to be able to just listen when they share. Can you talk a little bit about that, Terry?
Yeah, and I have had the same experience, both with patients as well as with my students. And so I think it's important to recognize when you ask the question that way, you have to be ready for the answer.
Mm-hmm.
And to a person last year, when I talked to some of my students, my mentees, and I said, no, really, how are you? Every single one of them started crying.
Yeah.
Men, women, old, young, didn't matter. They were all a mess. And so was I. And so sometimes we just cried it out together,
Mm-hmm.
and recognizing that, we're all struggling, that you are not alone is so, so powerful. However, I have had situations where I have had to call suicide prevention. I have walked students over to the resources on main campus. I mean, seriously walked people over because I wasn't confident. I didn't want to just let them go. I wanted to make sure that they got the care that they need right now. We've called mental health people, as we've gone through. And I think that that's so important, just being there for people, just listening, just realizing that, and then sharing, like making that person feel, not alone is so important.
Yeah. There's another question that said, do you have any tips on how not to compare yourself to others? I failed many times, have health issues, and am pretty stuck, but I see others who have failed and seem to bounce back more successfully, and it's hard not to wonder why they can do it and I struggle.
So one of the things that I have come to realize over time is that we all put our best face forward, right? Mm-hmm. So it may look like some of those other people are bouncing back faster, but maybe not. Maybe not if you dug, maybe not if you just asked, really, how are you? Maybe not. And I've had that happen so many times. And I think it's so, I know we all try to be cheerful and happy, etc., but it's, in a way, it's just not, it's not healthy, right? For us to, when somebody asks how you are, to just say that it's okay when in fact it's not. And so I think that recognizing that it might not be that they're better at it. It might just be that they just don't want to share right now, or maybe they can't. Some people just can't bring themselves to admit that they are also struggling and really kind of fake it. So just because they look like they're doing it doesn't mean that they are, and they might need help too. But I think especially for women, it's really important. And I got this from that Glennon Doyle's podcast. And somebody had asked her, like, why are women so competitive and always, looking at each other and comparing themselves? And her answer, I thought, was really insightful. She said, because we live in a world that is governed by men, and that at a table where there are 12 seats, 10 are guaranteed to be men, and women have to compete for those last 2. Mm-hmm. And because they've made us compete, this is how we have been raised to be. We have been raised to be not only self-critical, but critical of others. And I think it's time for us to start realizing that society has molded us in this way, but to recognize that it doesn't have to be that way. Mm-hmm. That we can say, like, I know they're making us compete for it, but we're not going to do that anymore. And also to force, the change of the world in general to say, no, there should be 5 women's seats and 5 men's seats, or, some seats for, gender fluid people, whatever. But I'm just saying that, like, there should be more for us. And also we should recognize that this is something that the society has molded us into, and then decide not to accept it anymore. We're not doing that. We're not going to be those judgy people. We're not going to be like that to ourselves and to others. And I can tell you that, like, I got to tell you, and I've had this talk with my grad students, that, like, I am worse to me than anybody has ever been.
We're our own worst critics, yes.
Right? Like, if a friend talked to me the way I talk to me, I would never speak to that person again. So we have got to lighten up on the self-talk.
That you bring up a very interesting point, and I was going to ask, what do you do on a daily basis to set that mindset for yourself? And I think that self-talk is probably really important. But is there anything specific that you do that helps you to walk in with that positive mindset?
I think that keeping a list of not only, the things that you have your CV, but then the things that you've done well over time and the things that you've succeeded at. I mean, obviously, the people who are attending this talk today, if by the measure of 98% of society, you are wildly successful already, right? They can't even imagine how you got where you are. And so in some ways, we kind of self-select, right? We are the people that pushed ourselves, and we push and we push and we push. And one of the ways we push ourselves is to tell ourselves that what we've done is not good enough. It's not acceptable. We need to do more. And that can be healthy to a degree. We're motivating ourselves, but we can't continue to beat ourselves and expect ourselves to excel. I think I'm losing my thread here, but hopefully that makes some sense.
Yes. So I think you're right. As women, we are, I think, trained to always feel like we have to do more, and we are doing so much that we're going to fail all the time. And so we feel like if we're not doing everything perfect, that we're a failure. And that's that self-talk. And we have to realize we need to look at those things that we're doing well, no matter what it is. And I love your idea of a book of keeping those things, because we've all had people say nice things to us, even if it's over our kids, which is fine too. But people have always, there's things that people say that really lift you up. And it's important to remember those, because we tend to focus on the negative things that people say. And people tend to say negative things. It's like when you ask for a review, you're only going to get the bad reviews. People who love what you're doing usually don't say anything. So it's really important to keep those and remind yourself of those. And I love your idea of having a book of those to look at.
It helps so much, because, like, sometimes when you get them, you're just like, you just kind of brush it off. But man, there's going to be days when you're going to need that.
Right. Well, is there anything else? I think we've gotten to all the questions. Is there anything else you'd like to share before we close, Terri?
Well, I just want to say that to get where you are successful. Remember that.
Great. Thank you so much. We so appreciate your time, and we so appreciate your willing to be open. And as someone said, relevant and, vulnerable. And I know the Bren always talks about being that way, and you've got to be vulnerable. And so I know that everyone that joined us today just absolutely loved it. So thank you so much, Terri. I will talk to you soon. And I'm going to go ahead and share my screen and get back to our presentation.
All right, my pleasure.
Thanks, Terri. So this was a wonderful presentation from Terri. We really appreciate it. It's just amazing to me how we have these wonderful experts that are in areas that we wouldn't assume they would have this type of experience or knowledge that they can share with us. So you never know what your pharmacist has that they can share. So just keep that in mind. So moving along, I want to share with you where our next session is. We're going to be doing them monthly. So we have one coming up October 20th, and we have a wonderful person. She happens to be a very close friend of mine, Yamila El Kahat, and she is one of our outreach services librarians at our medical library at the Health Sciences. And she is really going to be talking about how do you find the best resources, the best information when you're looking for health information, whether you're looking online or you're going to the library, where do you get those resources that you can really count on to be correct and truthful? And so she has a wealth of resources. She is going to be giving you great hints and tips to share with you. So we hope that you'll join us for our October 20th session. And until then, on behalf of our team here at the University of Arizona Health Sciences, thank you so much for joining us today. And as always, make sure that you bear down, vax up, and until we're through this pandemic, please mask up. Thanks so much. We'll see you all next month.